Good morning and good afternoon, everyone. This is Dr. Aditya Gupta. Welcome to another session of the art of solving MCQs, in which I'll discuss around 9 to 10 MCQs, which were conducted in the recently conducted grand test GT at DBMCI One. What's the goal of this session? You will be getting the GT explanations. You are giving GTs, not probably on one platform. You might be giving GTs of 10 different platforms. You'll be solving QBank. What's the goal of doing these sessions, these half an hour, 1 hour sessions once in a month? So the goal is this, to quote Sherlock Holmes, if you have eliminated the impossible, whatever remains, however improbable, must be the truth. The goal is to tell you that even if on the exam day you feel that you have not read that topic, or you have read that topic, you're not getting to the actual answer, you are, not remembering that particular answer, despite that, you can actually get to the answer by the process of elimination, by logical deduction, by simple reasoning, simple logic, things which you do on a daily basis can help you deduce the answer, can help you get to the answer, and you can make calculative guesses. Remember that what usually happens that over a period of next 6 months, let's say you start preparing in January, exam is in June, what usually happens that people will be stuck at this 130 to 140 score, around this 130 to 140 corrects. And if on the exam day, they are able to boost it to 150 to 160 correct, which is not a huge number, it's around 10 MCQs only, 10, 15 MCQs only. But the rank actually suddenly jumps from, let's say, a 20K rank or a 15K rank, 15 to 20K rank, it will suddenly boost up to become a top 5K or a top 3K rank, a top 5K or a top 3K rank. All right. So that is the purpose of this these sessions, that you're able to do these calculative guesses, you're able to use your logical deduction and simple reasoning and get to add additional 10-20 MCQs in your portfolio, in your correct portfolio, which will finally do what? Will boost your rank. All right. So that is a simple thing. That's what I want to teach you guys here. It's an acquired skill. Remember, this is an acquired skill. This is not something which I was born with. This is not something you are born with. We learn it by solving more and more MCQs, by solving more and more GTs. And I want to give you an insight into that. That is the main purpose of these sessions. All right, that is the main purpose of these sessions. All right, let's begin with the first question. A male patient presented to the clinic. This was a question which was asked. A male patient presented to the clinic with the following clinical features. He was diagnosed with a thyroid condition a few months ago. Then he has these skin lesions. Which are the following is the pathogenesis of these skin lesions in this particular patient? Now, I'll give you a very simple answer to this. First, I'll give you a very simple answer, but then I'll also tell you how you can derive the answer even if you're not getting to the actual answer. All right, even if you don't know the answer. This is, can you see this is nothing but vitiligo. This is nothing but vitiligo. And vitiligo, as some of you might know, is what? It's an autoimmune disorder. It's what? It's an autoimmune disorder. Vitiligo is an autoimmune disorder. That's why we sometimes give topical steroids for its treatment. Now, what is the pathogenesis? It's autoimmunity. So the answer here will be patient's immune system reacting to its own tissue. The answer would be option C. Now, this is if you know this is vitiligo. Let's say you didn't know this is vitiligo, or you're not remembering on that exam day that this is vitiligo. But had the examiner asked you what the actual skin condition is? Had the examiner asked you whether this is vitiligo or not? No, he's asking you what? He's asking you what is the pathogenesis? And he has given you a huge clue already. Thyroid condition few months ago. He's already given you a very big clue. Even if you don't understand what this particular condition is, from that thyroid condition clue, you can actually get to the answer. Why? For in adults, one second. Just 1 second, the screen will come back again. Yeah. So in adult, what is the most common cause of hypothyroidism? It is nothing but Hashimoto thyroiditis. Hashimoto thyroiditis, which is nothing but an autoimmune disease. It is nothing but what? It is nothing but autoimmune thyroiditis. And we all know this, that if you have one autoimmune condition, the chance of you having another autoimmune condition increases rapidly. So they have given you everything. They're telling you the patient has an autoimmune disease. They're telling you, they already told you patient has a thyroid condition means patient has an autoimmune disease. What is the pathogenesis of this? This will also be autoimmunity. This will also be autoimmunity. And what is autoimmunity? Patient's immune reactive system reacting with its own tissue. That's it. So that simple thyroid condition which they had given was the biggest clinical clue. Even if you could not recognize that this is vitiligo, you can still get to the answer. The first option, let's see, patient's body reacting to drugs. Have they given any history of drugs? Have they given any history of drugs in the question? The answer is no. So this cannot be the answer. So this option A cannot be the answer. Patient's body reacting to group beta hemolytic bacteria. Usually in case of acute rheumatic fever, in case of, in acute rheumatic fever, post-septic glomerulonephritis, that is the scenario where you will have this beta hemolytic bacteria. Have they given you streptococcus sore throat? Have they given you any skin infection with streptococcus? No, they haven't. Again, this cannot be the answer. Is there any history of sore throat? Is there any history of sore throat? No. Is there any history of infection? No. Autosomal dominant inherited condition. Autosomal dominant. Have they given any family history? Again, no. They haven't given you any family history. Option D is ruled out. They haven't given you any drug history. Option A is ruled out. They haven't given you history of sore throat. Option B is ruled out. The option that is left, like I said, with logical deduction, you can still get to the answer. The option is going to be option C. It's going to be option C. And this thyroid condition was the biggest clue that they were giving you. So even if you could not recognize that this is vitiligo, you can still get to the answer. You can still get to the answer. Now moving on towards the next question. Amongst the following blood bank products, arrange the following in the shelf life from the shortest to the longest. Shortest shelf life to the longest shelf life, and the products that are given to you are fresh frozen plasma, platelets, PRBC, cryoprecipitate. Okay. Now, then they are asking you to choose from the code. Now, first of all, the first thing that I'll simply ask you, like as an intern, for those who have done their internship, whenever you were charting PRBC, what would you do? You would say, transfuse PRBC over 4 hours. Transfuse PRBC over 4 hours. Whenever you had received the packed red blood cell, you would have understood that it was slightly cold, right? Whenever you would have transfused RDP, that is your platelet, random donor platelets, you would have written transfuse over 5 minutes. So which thing has a shorter shelf life? It's always going to be what? It's always going to be platelets. Platelets, in fact, are stored at room temperature. They are stored at room temperature. That's why the temperature is just the normal temperature that's outside the in the environment. And that's why they are transfused very fast, because they can have bacterial contamination because they are stored at room temperature. RDP are stored at room temperature. Platelets are stored at room temperature. They can have bacterial contamination. That's why they are transfused very fast. That's why the shelf life is lowest. They have what? They have the lowest shelf life. It is only 5 to 7 days. They are stored at room temperature. RBCs, they are given a little longer. So obviously that means their shelf life is a little bigger. RBCs usually have a shelf life of 35 days, 35 to 42 days, depending upon whether you are using SAGM or whether you are using CAPDM, like that. So it's around 35 to 42 days. While as far as fresh frozen plasma is concerned, fresh frozen plasma or cryoprecipitate, name itself is telling you everything. It's frozen. It's what? It's frozen. When something is frozen and when something has cryo again frozen, obviously this will have the longest shelf life. So we simply have to look for the answers which have A or D towards the end. Longest shelf life. So let's see that. So option A is saying C has the highest shelf life. Would this be correct? No, this will not be correct. We have ruled that out. The longest shelf life has to be something which is frozen. Again, this is also ruled out. The only thing which is left is either option C or option D. You can at least get to these. And amongst this, let's see. Option C is saying that A, that is your fresh frozen plasma, has the strongest maximum half-life. Then D, that is cryoprecipitate, is equal to PRBC. No. Obviously, PRBC will have a slightly lower shelf life as compared to cryoprecipitate. Finally, we come to the actual answer, that is the lowest shelf life is of platelets, followed by PRBC, followed by FFP, and equal to cryoprecipitate. That is the answer. And again, even if you did not know anything about preservation and everything shelf life, you can still make a logical deduction, right? Something which has the word frozen in it has to have the longest shelf life. You have, even if you had no idea, you can still get to the option C and D and can at least get 50% correct, right? Even if you forgot everything. So this is the way you can actually attempt MCQs. This is the way how you can attempt MCQs. So you should, where do you store any perishable item? You store it where? You store it in the refrigerator, or you freeze it. And that's why the fresh frozen plasma has the maximum half-life, maximum shelf life. So RDP 5 to 7 days, PRBC 35 to 40 days, and FFP has a shelf life. FFP and cryoprecipitate have a shelf life of 2 years, 2 long years. Alright, RDPs, they are stored at what? They are stored at room temperature. They are stored at room temperature, and they also have the highest risk of bacterial contamination. They have the highest risk of bacterial contamination. These are things which as blood transfusion that you should remember. Even during an internship, you would have done, simply transfused RBC once. You should have gotten this answer correct. Okay. Again, logical deduction, getting to the answer. Moving to the next question. Which of the following is not an indicator of good prognosis in major depressive disorder? Now, for those of you who don't know, I myself have suffered from, and during my internship, I've suffered from a major depressive disorder. I have suffered from an episode of depression. I got admitted for it also, and I'm doing well right now. At least I don't have depression as of now. I'm not on medications as of now. But yes, I did take medications for some duration of time. I did take therapy also, cognitive behavior therapy also. Now, this is one of the reasons I kept this question here. That what do you expect will result in a better function of a person, higher chance that the person resolves or becomes better from depression versus someone who doesn't get better from depression? Very logical. Nothing that you need to, this is not like prognostic factors in multiple diseases which you have to memorize. Simple logical. If you have good family, if you have good friend support, obviously you will have a better prognosis. And I was lucky. I actually had my family and friend support was the best. This is one of the reasons I kept this here, that even if you're someone, 20-30% of medical students end up suffering from depression. You might know someone who's in your, friend and who might be suffering from depression, and you should know these prognostic factors. Even if you don't know these are very logical. If you have a stable family, if you have good friend, good support system, obviously the prognosis of depression is going to be good, right? So the first option, a stable family functioning, obviously this will result in a good prognosis. This won't have a bad prognosis. Let's look at options B. No more than one previous hospitalization. Again, yeah. If they're simply telling you that once you were hospitalized, when I was hospitalized once, you can hospitalize anyone with depression if you're thinking, but they're not multiple episodes of hospitalization. He's not hospitalized 3 times, 4 times, 5 times, just a single episode. Then obviously that will have a good prognosis. No more than one previous. So single will be good. They're not telling of recurrent hospitalization, a single hospitalization. A history of more than one previous depressive episode. A history of more than one previous. If you are having multiple episodes of depression, obviously you will have a poor prognosis. If someone has depression year 2015, another episode in 2016, another episode in 2018, if someone has multiple episodes, do you think they will have good prognosis? More than one previous, obviously they will have a bad prognosis. So even if you do logical deduction, you can get to the answer. The answer is going to be what? It's going to be option C. It's going to be what? It's going to be option C. Okay. It's going to be simple. Option C is going to be the answer. So good prognostic factors include what? They include friends and family, good support system. Any good support system, you will have good prognosis. If the number of episodes, prior episodes is, you didn't have episodes less than or equal to 1. And if the duration of hospitalization was less than what? Less than 1 week. Or a single episode of hospitalization. Or a single episode. What are the bad prognostic factors? If you have these episodes combined with anxiety, you have episodes of suicide attempt, you have substance abuse, then you'll have bad prognosis. And these things you don't need to rote memorize. These are logical. If you have anxiety together, someone has committed suicide 2-3 times, tried to again, I should not use the word commit. They have tried to kill themselves by suicide. There have been episodes of suicide attempt. There have been instances of substance abuse. They'll have a bad prognosis. While if you have just one episode of depression once, one single episode of hospitalization, good support system, you will not have a bad prognosis. You'll have a better prognosis. You'll have a good prognosis. So again, in this simple way, you can get to the correct answer. Now, in the image given below, select the incorrect statement. So what is this? This is nothing but, you can understand, this is what? This is spina bifida. This is what? Spina bifida, which is a type of what? This is a type of neural tube defects. Now, let's look at the option. Let's look at the first two options. Deficiency of folic acid in the baby, deficiency of folic acid during pregnancy. Now, this is a very important dictum that I'm going to tell you right now. Very important dictum I'm going to tell you right now. If you have two options which are drastically opposite of each other, or which say the same thing except one simple point, the answer is in them. See, you can't have both the statements true. You can't have both the things together. Deficiency of folic acid in the baby, deficiency of folic acid during pregnancy. One of it has to be true. Either the deficiency is in the mother, or there is a deficiency in the baby. You can't have both. You can't have which of the following is the most common cause of, you can't have which of the following is an incorrect statement and two things saying simultaneously, this is the most common cause. CMV is the most common cause, another saying rubella is the most common cause, something like that. You can't have two statements saying the same thing. One of them has to be incorrect. One of them has to be obviously incorrect. So here also the same logic applies. The answer has to be in these two. Both the statements that there is deficiency in both the cases cannot be true. And now think logically. Who is given folic acid? Who is given folic acid? Folic acid is given to what? Is given to mothers. We all know this. During pregnancy, it's given to what? Mothers. And if mothers don't take folic acid, the child ends up having neural tube defect. Is there a folic acid deficiency in the child? No. It is the mother, when she does not take folic acid during pregnancy, that the child ends up having neural tube defects. So the incorrect statement here is deficiency of folic acid in the baby. Baby doesn't have folic acid deficiency. It's the mother. And mother during pregnancy who has folic acid deficiency. The correct answer is going to be option A. Correct answer is going to be option A. And let's look at other options also. There's deficiency of folic acid during pregnancy. Yes, that's why we supplement. Causes can include folate antimetabolites. Again, yes. If you have folate antimetabolites given during pregnancy, if you give them during pregnancy, then again folic acid deficiency can occur during the pregnancy, resulting in baby not getting the neural tube defects. Baby per se doesn't have deficiency of folic acid. Maternal obesity related to neural tube defects. Yes, obesity is a risk factor. Diabetes mellitus is a risk factor. Obesity is also a risk factor. Okay. Now, coming to another question. This is a question which I give very frequently in my GTs, in my grant tests. For those who have attended, not in my test and discussions. Very frequent question that I give in my offline test and discussions. Let's see the options. CMV, most common cause of sensory neural hearing loss in congenital infections. Zika causes microcephaly. Rubella, most common cause of SNHL. Now you know the answer has to be between A and C. If they are asking you to identify the incorrect statement, both the statement that CMV is the most common cause or rubella is the most common cause, both cannot be true. One of them has to be incorrect. One of them has to be incorrect. So even if you don't know whether option B and C, any idea whether they are true or not, you can rule them out. This is ruled out. This is also ruled out. The answer has to be between A and C. Because both of the statements cannot be true. Both two things together cannot be the most common cause. Most common cause is always one, right? Most common cause is always one. Now the answer here is what? Answer here is rubella. Answer here is what? Rubella. Rubella is not the most common cause. It is CMV. It is CMV. So a little bit about this, I just wanted to talk to you something which is very frequently tested in INI-CET. CMV is the most common cause of non-syndromic SNHL. 90% cases are asymptomatic. of congenital infections are asymptomatic. The 10% will have what? The 10% will have chorioretinitis, microcephaly, and periventricular calcification. and periventricular calcification. Okay, how can you remember? CMV. Again, CMV causes CMV. Okay, so only 10% of cases are symptomatic, 90% are asymptomatic. But remember, these 90% cases which are asymptomatic, they also later in life can end up having what? They can end up having sensory neural hearing loss. And in fact, it is like I said, it's the most common cause. As far as congenital rubella infection is concerned, congenital rubella syndrome is concerned, it has a triad of PDA, cataract, and SNHL. Although the triad of congenital rubella syndrome has sensory neural hearing loss, congenital rubella syndrome overall, because of vaccination, has reduced a lot. So much so that the most common cause of non-syndromic SNHL is now what? It is congenital CMV infection, not rubella. So this is one fact I wanted to tell you. This is one simple fact I wanted to tell you. But even in this question, you can always get, see, two statements together cannot be the correct. Two things cannot be the most common cause. So one of them has to be an incorrect statement. So you can at least get a 50% chance of getting these MCQs correct. Okay, you can have 50% chance of getting these MCQs correct. Moving on to the next question. A patient traveling at high speed, first of all, high speed, met with a road traffic accident. Okay, road traffic accident means what? This is trauma. Trauma means what you will be using? You will be using which algorithm? ATLS, Advanced Trauma Life Support Algorithm. His clinical presentation includes BP 80/40, hypertension, bleeding from nose, femoral fracture, difficulty in respiration, decreased respiratory sound on right. Initial management preference will go to what? Initial management. So there is decreased respiratory sound on the right, difficulty in respiration. Okay. Now in ATLS, always remember in ATLS, we know in ATLS, what is the sequence of? It's always A followed by B followed by C followed by D. That's how it goes. So first is always airway, followed by breathing, followed by circulation. This is always followed as far as any trauma is concerned. So if you go back to the question, this is a trauma question. We always have to follow A, B, C, D. Okay. Let's see what the options are saying. Hemostatic nasal packing. Is it related to airway? No. Is it related to breathing? No. Nasal packing will control the hemorrhage. So it is related to what's related to circulation. So this is what? This is C. This is C. Then let's look at other option. IV fluid administration. Again, this is related to what? This is related to C. Circulation. Chest X-ray. Why do you need a chest X-ray right now? Later. Thoracotomy tube insertion. This is related to what? This is related to B. And you have already decreased respiratory sound on the right side. You will do this. The answer here is going to be option B. The simple, in any trauma A, B, C, D. If something had said intubate the patient, that would have been the better answer. Airway always first, followed by B, followed by C, followed by D. Always remember, even if someone's hand is cut off, the first thing you have to look at is not the hand, it's the airway. Always remember, in trauma, the first thing is always and always airway. Even if someone's hand chopped off, you have a huge femoral fracture, anything, the first thing is always airway, then breathing. So here, there is nothing related to airway, but for breathing, you are doing a thoracostomy. So answer here is going to be option B. Is going to be B. Rest everything was concerned with C, circulation. Answer is going to be what? It's going to be B. Okay. Now, moving on to the next question. Which of the following, with regards to the following scheme, which scheme? The PMJ, the Aayushman Bharat scheme, something which we have seen in all the hospitals. If you have gone to a government hospital, you will always see this Aayushman Bharat. Which of the following statements is false? Again, something very logical. Even if you keep your eyes and eyes and ears open, you can answer this question. For the poor and vulnerable, yes. We know Aayushman Bharat is for the poor families. Do I require Aayushman Bharat, or do you with your iPhone will require an Aayushman Bharat? No. Do you have an iPhone Aayushman card? No. You're not poor and vulnerable. So we know this is a true statement. We know this is a true statement. Fair point. Covers hospitalization cost of 5 lakhs family per year. This is something which has been advertised so much. I think you should know this. This is also a true statement. Okay. Option C, secondary and tertiary healthcare. Yes. Where is Aayushman Bharat? It's in AIIMS. It's in your hospitals. We are secondary and tertiary care. If you saw Aayushman Bharat in your hospital, it means Aayushman Bharat is secondary and tertiary care. Every medical college by definition will be secondary and tertiary care. So if you know that you see Aayushman Bharat patients on a daily basis, you might see someone with that Aayushman Bharat card. You know this is also true. You know this is also true. Then if all these three statements, option A, B, C are true, then the only thing which has to be false is option D. And hence the correct answer is going to be option D. This is a false statement. Runs parallel with Rashtriya Swasthya Bima Yojana. No. It has usurped that Bima Yojana. This Bima Yojana is now defunct. It's now defunct. It's no longer used. It has been replaced by this, Aayushman Bharat Yojana. So even if you did not know, even if you had not read about Aayushman Bharat, the simple fact that you saw it in your hospital means you can say yes, that secondary and tertiary healthcare has to be a true statement. You know it's for poor and vulnerable people. You know, all right. So you easily got to two options, and it has been popularized so much in radio, in the TV, 5 lakh for everyone, that this one also you must know from your eyes and ears open, you know that this is also a true statement. And if you have ensured that the three options have been ruled out, you can get to the third actual answer, that the incorrect statement has to be what? It has to be D. It has to be what? It has to be what? It has to be D. Now, next question. A 5-year-old male child presents with episodic anemia and jaundice since birth. He's least likely to have which of the following? Okay. Hereditary spherocytosis, sickle cell disease, G6PD, paroxysmal nocturnal hemoglobinuria. What is the clue here? The clue here is since birth. You are having this. So hereditary spherocytosis we know is an autosomal dominant disorder in most cases. So you will have said since birth. Sickle cell disease is also autosomal recessive. It is inherited. You will have it since birth. G6PD is X-linked. Again, all these disorders are what? They are genetic disorders. They are genetic disorders. They are inherited disorders. They are genetic and they are inherited disorders. So they will be present since birth. So they will be present since what? Birth. But what is PNH? What is this paroxysmal nocturnal hemoglobinuria? You will remember from your path that PNH is what? PNH is a acquired disorder. It's what? It's a acquired disorder. You have acquired mutations later in life. In fact, as a pediatrician, I don't see PNH. You typically tend to see it in adults. So PNH is what? PNH is an acquired disorder. This is one thing which is given very, very prominently. Even if you read it once, you must remember that PNH is what? An acquired disorders. PNH is what? PNH is a acquired disorder. PNH is a acquired disorder. In which there is mutation in what? In this which there is mutation in the PIGA gene. PIGA gene is this phosphatidylenosytol glycan complementation A group A. You don't need to remember the full form. Which basically codes for delay acceleration factor, which is nothing but CD55. And membrane inhibitor of reactive lysis. Membrane inhibitor of reactive lysis, which is CD59. And the function of the CD55 and 59 is what? They inhibit complement. They do what? Inhibit complement. They do what? They inhibit complement. So what will happen in PNH? In PNH, there will be mutation, so PIGA won't function. If PIGA doesn't function, this decay acceleration factor and MIRL won't function. If these two things are not there, these two things will not be there. And the inhibition of complement will not be there. So complement will become hyperactive. There will be what? There will be increased complement activity. And whenever there is increased complement, there will be what? There will be increased membrane attack complex. There will be increased membrane attack complex. This membrane attack complex will cause hemolysis. This will cause hemolysis. But always remember, it's an acquired disorder. So in PNH, there is going to be hemolysis. There is going to be episodic hemolysis also. But the hemolysis will not be there since birth. You will acquire it later in life. So the answer here is going to be what? Option D. Proximal nocturnal hemoglobinuria. Okay. Next question. Image shown in injury shown in the image below can lead to. Now most people will think of it this way. This is what? This is boxer fracture. And then you will be like, in boxer fracture, what is the injury that is there? And you will try to rote memorize it. I would say, even if you don't remember what boxer fracture is, just look at the image. Let's see the image. How is he hitting? He's hitting it like this. So what is touching? Is this touching or this touching? Let's see. So this is here. What is touching? These will be the fingers. This thing is touching. This part. The little finger is touching. The little finger is touching. Is the first metacarpal, that is thumb, touching? No. Is the first metacarpal even touching this? No. So first metacarpal, ruled out. It's ruled out. The thumb is not even touching what you're hitting. If you're hitting it like this, is the thumb touching? No. You can rule out, even if you don't know which boxer fracture is what. Now, again look at this. Option C and D. Both are talking towards what? Both are talking towards fifth metacarpal, fifth metacarpal. So examiner knows you might remember fifth metacarpal. This is little finger, fifth metacarpal. Now he's asking neck of fifth metacarpal or base of fifth metacarpal. Now when you're hitting it like this, when again you're hitting it like this part will get injured or this part will get injured? Obviously this part will get injured. This part around the knuckles will get injured. So this is neck. This is what neck. Is it the base? Base is here. This is neck. Simple. So even if you don't know, they have given you the image. Even if you make a mukka like this, you can know that the injury is going to be here. Right? So answer here is what? It's option C, neck of fifth metacarpal. So this is how boxer fractures looks like. This is how boxer fracture looks like, where the neck of the fifth metacarpal is fractured. There is injury to the neck of fifth metacarpal. So even if you don't know, they have given you the image. They're literally giving you the image. They're telling you are hitting it like this. They're easily telling you that the first and the second metacarpal are not getting involved. They're telling you the fifth metacarpal is getting involved. And they're telling you they're hitting like this also. They know it's neck. It's not going to be the base. They've given you everything in that image. You don't need to know that boxer fracture is neck of fifth metacarpal. They've given you everything in that image. Right? They have given you everything in that image. And last question is a very simple question. Rabies is a deadly viral disease that primarily affects the nervous system. Considering the unique characteristics of the rabies virus, which the following statement is accurate? It is already telling you it affects the nervous system. Option D is the correct. Rabies virus has a predilection for infecting neural tissue. Sometimes the answer is there in the question itself. You don't even need to look at the options. You don't even need to look at the option. Let's rule out other options still. The virus spreads through contaminated water. Does it? No. It causes hydrophobia, but how does it spread? It spreads through dog bites. We know how does rabies spread. My own dog, pet dog, Shih Tzu, has bitten me so many times. I have gotten so many times the post-exposure prophylaxis. Now, my dog bit me. I got post-exposure prophylaxis. I did not develop rabies. It means the post-exposure prophylaxis is working. Post-exposure prophylaxis is ineffective. No, it's very effective. So these options are immediately ruled out. The answer is very simple. Option D. They're telling you it affects the nervous system. Because it has a predilection for the neural tissue. Simple. So this is the way, we discussed around 9 or 10 MCQs today. So this is how you have to solve the MCQs. That on the exam day, be very, very, don't become dumb. My simple thing is don't become dumb. Use common sense. Very important. Simply use common sense. If you keep your eyes, ears and use your common sense with simple logical deduction, and you can, if you're already at 140 corrects, the remaining 60, even if you attempt them all and you have ruled out 1 to 2 options, you will easily get 20 to 20 plus corrects more, and your corrects will move to 160 and your rank will improve very, very drastically. Alright. So this is the second part of the Art of Solving MCQ series. I'll take leave today. Alright. Thank you and have a nice day, and keep on solving GTs, keep on giving GTs, because the more practice that you do, more GTs that you give, the better your MCQ solving ability will become. And as far as solving, I had made a channel on how to solve MCQs in my, how to solve QBank in my videos, but I'll simply tell, first do PYQs, then do important topic modules along with regular GT practice. That's all that's required. Alright, thank you and have a nice day. Alright, good night.